Good morning, good morning, good morning, or good afternoon, good evening, depending on when and where you're watching this live. This is the voice and the face of Dr. Olabintan. I am the CEO and co-founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas. I'm excited to be with you today for another Facebook Live on the topic, Doc, I have had pain for a long time. Any tips to help me? If you are watching live, please comment hashtag live. If you are watching replay, hashtag replay, tag a friend, and have them come join us to see, what we can learn today and what can help improve the quality and quantity of life. Let's see. It's saying we're having issues. Huh. All right. It says they're having issues streaming on Facebook. Deleted. Da, 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 da. Okay. View on Facebook. Let me see. Sorry, we're having a little bit of technical issues. I want to make sure that this is streaming live to all the platforms that we have. And let me see. Okay. All right. And we have our guest in the background. Give me 1 second. Let me make sure. It's saying it's having issues streaming. Okay, if we have to share this after the fact, then we may have to do this. It looks like it's streaming on LinkedIn and YouTube, but not quite um, on Facebook. Okay, that's fine. We'll share this after the fact. Now, before I have my guest on, I just want to chat a little bit about why we have these talks. We do this with our clients, with our patients in mind, and we do this to help improve your quality and quantity of life. So if you know someone, like I said, who could use this, please share this with them, tag them in the comments. And also, if there are topics you want us to talk about, I'll be happy to come on here and have a discussion if it help improve your quality and, of course, your quantity of life. At this time, I'm going to bring my guest on. Her name is Dr. Ruth Reid-Thornton, and she's a board certified PM&R doctor. She's also a holistic and integrative medicine doctor who has helped patients rehabilitate from injuries and complications of diseases. I also have one more favor to ask before I bring her on. If this has been meaningful to you, please like, subscribe. It helps empower us to keep keeping the message or pushing the message across for people who could benefit from this. All right. That being said, I'm going to have her come on. Hi, Doc. You found it.
Hey, Dr. Tolu, good to see you.
Saturday. How are you?
I'm fine. I'm fine. It's early here, very early here in California. So,
Oh my goodness. Well, thank you for agreeing to do this so early in the day for you.
oh,
I,
sure.
I think it's about six o'clock there.
Yes.
Yeah. I saw that because I know I'm talking with you afterwards, and I'm like, oh my gosh, she woke up early for this. So I appreciate you doing this.
Mhm.
Before you joined, I was just introducing you, but I'm going to hand it over to you. Kindly introduce yourself. Who are you, Doc, and what do you do?
Oh, sure, sure. So, again, thank you so much for having me. I really am honored. I'm Dr. Ruth Reid-Thornton, as you said, or Dr. Ruth. A lot of people call me. I've been board certified in physical medicine and rehabilitation for more than 20 years. I also got certified in holistic and integrative medicine. Really, it was a journey. I learned about integrative holistic medicine through another doctor who wasn't practicing straight physiatry or traditional medicine anymore. She said that her first step was going to a food as medicine conference. I went to the food as medicine conference and I was really blown away. Traditionally in med school, we're just not taught about the importance of nutrition. And we think it's not important, but it actually is very important. I learned, my goodness, which a lot of things now we're talking about, but at the time I was learning is like the microbiome and the importance of the probiotics and prebiotics and all those things. I had no clue. The other thing though is that I really like my specialty, PM&R, because I really like the idea that we're working with the full person, not just a body part, not just an organ system, and the idea is to help them function in their community. And I noticed that I had a little resistance or reluctance when I saw the people with chronic pain. And I'm talking a long time ago, which is not like me. I mean, I love people. So I had to look at what is it with me? Why am I, kind of like having this thing? But the thing is, I like to see people get better. I like to see people get better. So it's been an interesting journey of learning myself and passing on what I've learned, because I've actually seen people with chronic pain get better. And that's just been a blessing. So.
Now, you mentioned the name PM&R. I don't think a lot of people know what that is, okay? So I want you to, if you don't mind, just kind of spell that out a little bit so our viewers know what that
Yeah,
means.
sure. I know we're like the best kept secret in medicine. It's been around since the 40s, since World War II. Basically, it started as a specialty to help the war veterans coming back from the war, World War II, with injuries. And you can say we're a cross between neurologists and orthopedists. We don't do surgery, however, but we work with those same diagnoses, those same clients. So, and as I said, I work with physical therapists, occupational therapists, speech therapists. We're the medical part of that medical team to help with people with their injuries. So.
Okay. Why do you do what you do?
Oh my goodness. That's a very good question.
I know it's a lot. Why do you do what you do?
Elevator answer. I love people. I love people. I wasn't naturally good at science. So, I wanted to do this because it was difficult. I could have done something else that would have been easier for me to do. But it's been rewarding. And I just have to say I was called to it. That's really all I can say is I was called to it, and I know that I'm doing a good work.
Awesome. I love it. I love that you own what you do and that you know that you're making an impact. That's very, very important. It keeps you going.
Yes.
Awesome. So my first question, Doc, let's talk pain. What are the different types of pain? I know there's a loaded question. And what essentially is pain?
That's a good question. Pain is a noxious, or noxious just means a fancy word for pain, but it can be both an emotional and physical unpleasant experience, either from actual tissue damage or the perception of, but that's sort of it in a nutshell. If I read it, I could read a better definition than what I just said, but that's kind of it. It's both emotional and it is physical, and it's unpleasant.
Mm, mm. And so the next question brings the next question. And this is a very, like, our whole goal here is to help patients with chronic pain kind of thrive, much more than just kind of chug through life, but to thrive. And so I like that you're an integrative medicine doctor as well. Are there any lifestyle changes, generally speaking, that let's say I'm a patient, I'm asking that I can make to help manage my pain? What would you say to that?
Absolutely. There's so many things. One, they should really look at their diet. A lot of us, the standard American diet is really an unhealthy diet. What we eat as just normal, unfortunately, because most of us don't eat vegetables at all, or very few. The only vegetable maybe we eat is French fries. That's that's just not sufficient. So just even making those kind of changes, having 7 to 9 different fruits and vegetables a day. I know that sounds like a lot.
Ooh, I have patients struggling with 3 a day. You say what? How many?
7 to 9 different fruits and vegetables a day.
I didn't say it.
Yes. So they used to say 5 fruits and vegetables a day. I don't know if you remember back when.
I remember the 5.
Yes. Yeah. But the thing is, our soil is so depleted. They used to do whatever they had to do to kind of replenish the soil. They don't do that anymore. It's the industrial farming is not the same. And so the fruits and vegetables don't have as much of the nutrients as they used to have. So that's why they're recommending people eat more every day. But you can do that if you spread it throughout the day. You can do that if you put them in a smoothie, in a salad, a soup. There's ways to get it in there. So yeah, 7 to 9 different fruits and vegetables a day, lots of water. Some people just average 8 glasses a day, but as much as you can. I know a lot of us we just don't drink enough water either. So, and we are really like 70-80% water, but many times if we're not drinking enough water, there's so many different things that happen. Your metabolism, your bodily functions are not functioning at their optimum because everything's slowed up. When you fully hydrate, then all your physiologic reactions that are going on in your body can optimize. They're optimized. A lot of times people will feel more energetic when they're drinking more water. Exercise on a regular basis is very helpful, even with people with chronic pain. And I know that probably somebody will say, it hurts to exercise. I can't exercise. It makes it worse. And that may be the case at first, and you may have to work with a therapist or learn some things that you can do without aggravating your pain. But the whole idea is when you have pain and you become sedentary, you're making your body weaker. And when you make your body weaker, then it does hurt more to move. So, you kind of have to do those things to counter that. Sometimes people, especially if it's joints, they might find that it helps them to do aqua therapy because your body's more buoyant. You can move more easily in the water without it causing pain. So that's something to put out there. Yeah.
Awesome. You said a lot, and I wanted to go back to the fruits and veggies. So
okay,
I people are like, 7 to 9 fruits. Like, how do I know? I say your fist size, 5 to 6, so 7 to 9 fist size worth a day. And I love how you mentioned the different varieties of how you do it. You could slurp it, you could blend it, you could dice it, you could chop it, you could freeze it, whatever it takes to get it from outside your mouth to inside your mouth. And the truth is, these changes, it's not like overnight. It's like, whoo, you understand? But I want to encourage those who are watching, based on what Dr. Thornton said as well, that you keep doing these rather mundane, repetitive things. Over time, you notice a difference. I've had patients say when they did the Daniel's fast, that their joints hurt less. And I'm like, okay, how much of the Daniel's fast can you continue? A Daniel's fast is essentially when you leave meats and you just eat fruits and vegetables for a period of time. And almost like a way to reset your body, spirit, and soul too. So it's I really wanted to kind of highlight those things that you said. They sound very simple. Please do them. Your body will thank you for it.
Right. There was a study in Guam. I'm not sure what year it was done. It was sponsored by Loma Linda University, but they basically have an epidemic of diabetes there. So we're not talking about chronic pain, but similar issues. And they took half of the control, basically just took their medications. And the non-control, the experimental group, had diet and exercise. So they were eating healthy. They were walking 30 minutes twice a day. And eating maybe chicken, not eating red meat. Anyway, within a week's time, the people who were in the experiment started wondering what's going on, because they were having bowel movements every day, and they were used to having it like once a week, and they didn't know what was going on. But you're supposed to go at least once a day. People don't realize. Within a couple of weeks, they noticed their joints, were not so painful. So it's interesting. It was a 3-month study. I think they had to abort it early because the control group started, I want to get better too. So they started doing the stuff that the experimental group was doing, which, messed things up. But it helped their diabetes. It helped their blood pressure. It helped their cholesterol. All the things that we have issues with. Exercise, diet, it just made a huge difference for the whole community, so we don't emphasize it enough, I think, in our society, who's that's another issue, but who's profiting from teaching you preventive stuff, So anyway, yeah, it does make a huge difference and can make a difference with your pain.
Yes, so be encouraged. You're worth it for those who are watching. All right, Doc, my next question is, can you recommend, of course, these are medical suggestions. We do definitely encourage patients and people watching to make an appointment with your own doctors to come up with a plan that's customized for you. But Doc, can you recommend, generally speaking, any exercises or maybe not particularly physical therapy, but to help people manage their pain?
Sure. And what you just said was important too. If someone doesn't know the cause of their pain, especially you've had even just a couple weeks of pain and it's not going away, you should see your doctor. So be examined, be evaluated. You don't just use Dr. Google, just find out what's going on.
Right.
Just as simple as walking. Just as simple as walking would be a great exercise. You say, I can't walk for 5 minutes. Walk for 5 minutes until walking for 5 minutes is comfortable, and then you can walk for 10 minutes. Start where you are. Breathing exercises. And that sounds like you're not moving much at all, but many of us don't take deep enough breaths. We're not bringing in enough oxygen. So if you could even learn just to meditate and breathe, that is a very, very minor in terms of exercise, but it can do wonders for you, to get you started. I think for myself, I have issues with tightness, my shoulders and neck, and I find vinyasa yoga, which is more stretching and holding it, is very, very helpful. So especially if you say I really can't move and you're stiff, you want to do things like that. So that's some suggestions.
Movement is key. All right, Doc, next question. Are there any supplement? Because, there are a lot of over-the-counter type stuff. Are there maybe supplements or other at-home things that people can do for pain? Is it easily accessible, not doesn't break the bank? What would you say to that, Doc?
Yeah, so there's lots of studies around apple cider vinegar. I don't know if you've seen those. They're actually, I believe they're true. For some reason, many of as I was talking about, the standard American diet is too acidic. But our bodies are, what is our pH level, 7.6 or something like that. Anyway, having the apple cider vinegar, like it comes in capsules too, but you could make it into a tea. I have had that with some honey. It helps to put us back at a better, less acidic balance and more healthy for us. And they found it's helped with inflammation. It's helped with a lot of things. I can't think offhand with that. So that's something very inexpensive. That's probably in your kitchen. Turmeric is known. Lots of studies that show it's a strong anti-inflammatory, very, very good. Having these anti-inflammatories that from your food as opposed to, say, in a pill might be a better way to do it. Less risk of the complications of if you're taking, say, Motrin, every day for months versus taking turmeric. It may be a better way to get your anti-inflammatory without having, the concentrated thing that's in a pharmaceutical. So that's another one. And turmeric is a seasoning. So I mean, if you like curry, you have it in your food, but it also, they're putting it in teas. Yeah. So.
Yeah, I recommend apple cider vinegar for quite a few things, including acid reflux, even though it can clear too. But it tastes though. Whew. Can't let it sit for long because even the smell is like, whoa, but it definitely helps. Turmeric definitely, you can put that in your foods or your seasoning. I also like ginger.
Yes, I love ginger. Absolutely. Yeah.
Everyone goes around chewing ginger all the time. Like, yeah, it's anti-inflammatory.
Yes.
All right, Doc. My next question. There's a lot you mentioned, Dr. Google, and I tend to caution my clients and people in general about Google searches. And so my question to you is this: for someone who's watching, like, is there any support group or resources for people with chronic pain that they can relatively safely kind of go to see questions answered? What would you say to that?
That's a very good question. I have seen lots of Facebook groups for chronic pain, but I would say, as far as a supportive group that's free to join, has lots of information, is the American Chronic Pain Association. It is a lay organization for people who suffer from chronic pain. That it's everyone there suffers from chronic pain. They have resources that you can either get for free or some for purchase that could be helpful to people. So that's one that I would recommend.
All right, awesome. The American Chronic Pain Association.
Hmm.
That's really good. Thank you. Thank you. So there you have it. All right, Doc. Just a final word for our viewers, for someone who's watching, who's saying, yes, I've been, they've been dealing with this chronic pain for so long. And some days if you're frustrated, and any last words of encouragement to them, Doc?
Absolutely. I think it's important to understand that chronic pain changes your brain. It just does. And chronic opioid use also changes your brain, both in the bad way. So I would recommend that people have hope, even if it's just a mustard seed size, because the point is that these things cause depression. It's no coincidence. Of course, it makes sense you get depressed because you can't move and you're in pain, but physiologically things are happening as well. So, the things that cause joy or bring joy are so important. Um, a gratitude for what you do have, because whatever positive things you need, um, they will help you with your healing. So I've had lots of people to tell me, oh, this pain will never go away. It's 9 out of 10. It's 8 out of 10. And after working with me and doing the things that they particularly need to do, and they're saying it's 5 out of 10. I said, see, you said your pain will never get better.
Hmm.
It's 3 out of 10. Hey, it can get better.
Hmm.
It can get better.
Hmm.
So don't lose heart. Fight those thoughts when you have those thoughts to say, I'm stuck. No, fight that. No, I may not have found a solution yet. There's a solution out there. I will find it. You have to be positive. You have to have hope. So that would be my suggestion.
And cling to things that contribute to your joy, um, and fight negative thoughts. I love it, Doc. This has been very, very powerful. And I'm trusting that those who are watching this, also are encouraged by it and are powered by it. And that leads me to my next question, Doc. Where can people find you to connect with you, have you come speak on their platforms, or just to follow you also for content that applies to their lives and that makes for a better quality of life, Doc? Where can people find you?
Sure. So my practice is a telehealth coaching practice, Chronic Pain Rescue. So chronicpainrescue.com. I'm on Facebook. Chronic Pain Rescue is on Facebook, Instagram, YouTube, and Pinterest. You can find lots of content there. People can work with me. I'm forming a group therapy program, which I think the group is helpful. That African proverb that says, if you want to go fast, go alone. If you want to go far, go together. So I just think that having that community would be helpful for anyone. When you're trying to overcome whatever it is you're looking to do, having that accountability, having that we're all working on the same goal. So yeah, they definitely can follow me on any of those platforms. On Thursday, August 31st, 7 p.m. Pacific time, I'll be having a chronic pain masterclass. They can go and sign up for that for free. And we'll talk more in depth about, how does chronic pain develop, and what are the things that can be done to get out of it. Yeah.
Awesome, awesome. You're on Pinterest, Doc?
Yes.
What you do?
Yeah, you know what? Pinterest actually lets you put reels on there. Yeah, you
Are
can.
you serious? Oh
Yeah.
my God, you are amazing.
Oh.
And Doc, I gotta say, do me a favor though, when you do have that program, that's next week. Can you tag me so I can share it?
Yeah,
I'd love
sure.
to have people
Absolutely.
get I put it on the screen as well. You said August 31st, right?
Yes.
Okay, so I put it there, Pacific time, so it'd be about 2 hours behind us for those who are watching.
Right.
And I really want to appreciate you for taking the time. You are up at 6 a.m. to do this with me. I appreciate you. You are awesome. I look forward to doing this with you again, maybe in a couple of months. So I always like to put you on the spot so you can't say no.
Okay.
We'll
That
do
would be
this.
fine. I would love to do it.
We'll do this again. But thank you so much for coming. This has blessed me as well. I'm taking notes, and I'm even more empowered to help people with this. So thank you so much, Doc.
All right. Thank you so much for having me. It's been a pleasure.
All right, awesome. And for those of you who are watching live, I appreciate you for watching live. Thank you. As always, share. I can't tell who's watching live, so next time maybe put a little comment so I can give you a shout out. But thank you for joining. And as always, if you or anyone you know is looking for a thorough, a passionate, and a caring family physician who will have conversations like this to help you live long and well, I am she. Have a good one, everyone. Doc, have a good one, okay?